Now, with the mandate on large events from Governor Jay Inslee, testing in Washington state could ramp up as more people will be required to show proof of a negative COVID-19 test. Tim Pham is live this morning at Spokane Falls Community College, and this is actually where the new mass testing site is opening today. So, Tim, can you tell us what people need to know if they want to come out and get a test today?
Hey, good morning, Channing. Yeah, that's right. There are a lot of people expected to show up to this testing site. This, of course, going to be one of the major testing sites here in our region. This after a testing site closed earlier this year. So this morning we're joined with Daniel Pulse here with Discovery Health. Discovery Health, the operator of the mass testing site here in Spokane. Good morning. Thanks for being with us.
Good morning. No problem.
Daniel, so tell us a little bit about why this testing center is opening back up in Spokane. I know the last one closed earlier this year. Why is this one opening back up?
Yeah, with the new, well, not new anymore, but with the Delta variant, we've seen
Sure.
a huge increase in positivity rates. Spokane Regional Health District and the State Department of Health identified this area as one that needed additional testing capability in order to identify cases early and make sure that people are staying safe.
Sure. So are you all expecting hundreds of people to show up at this testing site daily? Because I know demand, it's been hard to find a test in Spokane County, really across the state.
Yeah, absolutely. We do think that there's going to be really high volume here. We're not 100% at this point. Our scheduling tool is open. I haven't looked at the numbers this morning, but we're building capacity such that we can test 450 to 500 people per day. We are putting in a second site as well over in Spokane Valley, though that site isn't set yet, so we're not exactly sure where it's going to be.
Okay, explain what people need to know if they want to schedule an appointment. Do they need an appointment? And then how will this flow work here at Spokane Falls Community College?
Yeah, it's super easy. They can go to discoveryhealthmd.com/SFCC. That'll take them to the scheduling tool. They can book an appointment there. They can input their insurance information there. And if they need to reschedule, they can do that there. So super easy. If they don't schedule, that's fine. They can still show up. We do encourage people to schedule an appointment. That helps us for a variety of reasons. But once they're here, they're just going to pull into this area. The entrance is over that way. You can't see it on camera, but super easy to find. We're going to have a lot of signage out, and they'll just pull straight through. If they have insurance information, they should put that in as they register. If they can't figure that out, they can bring it on site. We'll help them put it in. If they don't have insurance information, they can still show up and we'll get them tested.
Okay, and then tell us about the type of test. It's a PCR test, but this is not the rapid kind that you'll get an instant result.
That's correct.
You'll get your results at least a day or so after?
We're looking for a 48 to 72 hour timeline. It could be faster than that, but we want people to prepare for the longer timeline, just in case. We know that labs are backed up with the increased positivity rates, lots of testing happening. This is a lab-based PCR. It's going to be the most accurate result. And we'll get those turned around pretty quickly, as quickly as we can.
And I know you all were also advertising jobs. You're hiring for several positions, and that'll be crucial, especially if demand picks up. Talk a little bit about the jobs that are still open.
Yeah, we still have a few jobs open. We're looking for good site leads or site managers. Those are going to be people who are going to manage the site on a day-to-day basis. And if we decide to expand to 7 days a week, we may also need a site lead, because obviously one site manager can't be here every day. So those are great. We also need administrators. That's what we call the people who check people in. They help make sure that traffic is flowing right and that people have all their information in, put labels on tubes, that sort of thing. And then we need sample collection staff as well. Those are certified medical assistants and or above with medical certification that can do nasal swabs and do those collections.